As I reflected on the forum discussion question about being in a situation where the roles and responsibilities of my fellow team members weren't clearly defined, I thought of a recent project I was invited to be a part of. I realized that our team's missing element was having a poorly defined timeline. So while all of the team members knew that the final product was due in 3 months, we hadn't set clear and measurable interim goals or assigned who was going to be responsible for them, resulting in confusion and apathy. Thankfully, this was resolved with a clarified, defined timeline. Let's now discuss scope of practice. So far, we've discussed that there are lots of different healthcare professions, each with its own roles and responsibilities. But since many professions have some roles and responsibilities which overlap, such as between medicine and nursing, how is it determined who is allowed to do what? And is the practice of a particular skill or activity limited to any one profession? A scope of practice is determined by national and state licensing boards who define the rules, regulations, and boundaries within which a fully qualified practitioner who has the appropriate training, knowledge, and experience may practice in a field. A scope of practice focuses on patient safety and answers the who, what, when, where, how, and why of professional practice. Scope of practice is also governed by requirements for continuing education and professional accountability. Physicians were the first health professionals to obtain legislative recognition and protection of their practice authority. However, healthcare education, technology, and evidence-based practice have evolved such that most professions now share some skills or procedures with other professions. No one profession owns a skill or activity in of itself. Therefore, it is no longer reasonable to expect each profession to have a completely unique scope of practice. We're now going to hear from Dr. Joanne Spetz, a professor in the Institute for Health Policy at UCSF, who will discuss why scope of practice is important, how it is determined, and an example of why a scope of practice may need to change and the implications of doing so. She will also address how the process of determining scope of practice might change in the future.
Scope of practice refers to the scope of work that a health professional can do within whatever practice that they're working in allows them to do. So scope of practice often refers to the legal regulations that surround practice of licensed professionals, but also can refer to local rules, organizational regulations, organizational policies that also affect the scope of work. It's important because this really defines the work that each health worker does within a healthcare system. There are two major reasons that scope of practice changes might need to be considered by an organization or by a state legislature or a governmental entity. One is that when you have regulations that are overly restricted, you are not fully leveraging the skills of your workforce. If you have professionals who in some states or jurisdictions are allowed to practice fully independently, but in other jurisdictions they're restricted, they're probably being educated to practice fully independently. So those restrictions essentially are wasting their skills and their knowledge and their training about being independent. So we don't want to waste our human resources. We want to be able to leverage them fully, and so these restrictive scope of practice regulations can create a mismatch between education and training and then the work that's actually being done. A more practical reason why we might want to look at scope of practice changes relates to health workforce shortages. Across the entire world, you find big imbalances between, for example, urban and rural supply of health professionals and health workers. In areas where you have shortages, which tend to be rural areas, it can be very hard to recruit and retain professionals. In those areas, if you also have restrictions on the work that people can do, it makes it even harder to get the amount of care done that needs to be done for your population. So now there are some important implications of making those changes. You have to be very careful about the quality of care that's provided. You have to be careful to make sure that the education and training is still aligned with the outcomes that you want in order to ensure that these scope of practice changes are really effective in meeting care needs. A great example of a type of regulation change that occurred in Alaska was the use of dental therapists. Dental therapists are professionals who are trained specifically to provide certain kinds of dental care, such as filling simple cavities. Alaska rural regions had an incredible shortage of oral health professionals. Essentially, some of these towns were so rural, so out of the way, they could not get a dentist to even come and provide a basic filling. So if a kid needed a simple filling, they had to be flown all the way to Anchorage. It's tremendously expensive to do that. So what they did was train people out of high school for several years in how to do some basic oral care of irreversible procedures like certain kinds of fillings, and then those workers went back to their villages, their communities, and were able to provide those services. So that helped make sure the services were being met. The question next is, was the quality good enough? And fortunately, a number of different organizations went in to study the work that was being done by the dental therapists and assess whether it was of sufficient quality to justify continuing the program. In the end, they concluded that the quality was great and the services were well provided to the rural populations in need. Other states are now looking at similar programs. For example, Minnesota has now implemented a dental therapist credential. Scope of practice is often thought of as a regulatory determination, that a state or government jurisdiction of some sort will establish rules and regulations about what kinds of things each health professional can do. Sometimes those regulations are very vague and will say things like, this kind of worker is allowed to do anything that they have been trained and are competent to do. So then the determination of scope of practice essentially comes down to the definition of the education program. Other states are very prescriptive, where they will say a health professional of this type may do X, Y, and Z, but they may never do A, B, and C. So these laws all have different ways of structuring the definition of what is legally permitted. But scope of practice is also affected by organizational factors. You find, for example, some hospitals that will not allow nurse practitioners to admit patients, discharge patients, or perform rounds independently. So in that case, even in a state like New Mexico, where a nurse practitioner can practice fully independently under the legal scope of practice, the hospitals are implementing regulations that restrict that scope of practice. So in the end, the actual practice that a health professional is allowed to do is really a complex interaction of the legal requirements and the organizational requirements. Debates about the legal scope of practice for health professionals often are spurred by shortages of health professionals. We've seen this occur in multiple countries, where you might experience a shortage of rural providers or certain classifications of providers or services, and then there may be a creative effort in order to remedy those kinds of shortages. For example, in Malawi, there are severe shortages of both physicians and nurses, particularly in rural bush locations. They were finding that many women were dying in childbirth because there was nobody available to even perform a cesarean section. They established a program to train clinical officers who then are deployed to provide specifically cesarean sections. That is essentially all the training they get is focused on childbirth and C-sections. And while their outcomes maybe are arguably not quite as good as a midwives or a doctor's, it's much better than having nobody trained at all. So in that country, they looked at a change in the scope of practice in order to address a severe problem with maternal mortality and also a severe shortage of licensed health professionals. Often in the United States, you see debates occurring across states about why one state will have one kind of regulation and a different state will have a different regulation. And you might see changes in terms of the access to care in one region versus another, or movements of health professionals across borders because they want to practice in places where they can leverage all of their education and all of their training. In the United States right now, the increase in the number of people with health insurance who are demanding more primary care services has raised a lot of concerns, for example, about access to primary care. So with the access for primary care being a major issue, then we're beginning to look at some states considering changing regulations about who can provide primary care and how teams can interact together. This is leading to questions about, should nurse practitioners be allowed to practice independently in every state as opposed to just some states? What are the proper roles of medical assistants, and can they be licensed and authorized to do more than they are allowed to in some states? And what other health professionals might need credentialing and might need to have an expansion of their scope of practice and education in order to better meet healthcare needs?
The key learning point for this section is that no one profession owns a particular skill or activity. It's the entire scope of activities within the clinical practice that makes each profession unique. For our forum discussion question, I'd like you to think of one question that you feel is important to know about your own or another profession's scope of practice, and find an evidence-based answer. For example, as a dentist, I wonder whether dentists in California can inject Botox for cosmetic purposes. A couple of resources that I might use to find my answer include the websites of the California Dental Board and the American Dental Association.